Hello friends, Saima. I'm an MD MPH, and for those who don't know me, I have a background in public health. This is a segment that is a continuation of the last one as promised. It took a little while longer because, we all have to work through the week, so as soon as I get a chance, I'm back. Today's segment is going to focus on symptomatology, prevention, treatment mainly, and I might touch upon modeling and predictions of where this is going with the coronavirus pandemic. So I get asked questions like, I have a sore throat, a cough, a headache, and some muscle aches as well, but no fever. Could it be COVID-19? What can I do to ease my allergy symptoms? Could it be early or mild symptoms of COVID-19? What about the loss of smell and taste that we've heard about? Is that a sign of COVID-19? If temporary loss of smell or taste does in fact turn out to be an early symptom of the disease, would that change how doctors handle the illness? Bottom line, what should we do if we show symptoms of allergy or something that might be COVID-19? Well, we should understand, first off, the main symptomatology that we see for COVID-19. There will be fever, there will be shortness of breath, there will be body aches, which is myalgias in doctor language, fatigue, you feel very, very tired, a sore throat that comes on at first, GI upset, nausea, a little bit of diarrhea, loss of taste and smell, and sometimes even reportedly a red eye or conjunctivitis. So clinical course runs somehow like this. There's exposure, 2 to 11 days, and typically 5 days on average. Later, there may be flu-like symptoms like fever, headache, dry cough, aches and pains, nausea, abdominal discomfort with some diarrhea, loss of taste and smell, not feeling like eating, lots of fatigue. What happens next? After 5 days, or an average around 5 days later, when you fall sick, you get increasingly short of breath. What we see is that these are symptoms of viral pneumonia. Your chest feels weird, or it may not feel weird at all, and we only notice it when you come in to see the doctor for these for shortness of breath. When we check your blood oxygen, that might be lowered to almost around under 92% oxygen saturation. In very severe cases, which happens around 10 days later, we see full-blown inflammation, what we call a cytokine storm. A cytokine storm can be considered to be a full-on inflammatory reaction within your body, and that leads to something that we call acute respiratory distress syndrome and multi-organ failure. And you can literally watch it happen within a couple of hours. And what that respiratory distress means is that you are having absolute difficulty breathing, and this is the point at which we need to put you on a ventilator and intubate you, which is to pass a tube down your throat and nose and get the lungs to expand and breathe by assisting your breathing on the machine. So how are these, remember, how are you going to differentiate all of this from the allergic symptoms? So in allergies, if your illness is going to start out, it's going to look something like congestion in your upper respiratory tract, you're sneezing, you're wheezing, you have a very itchy nose and throat, you have itchy ears and eyes, you have sinus congestion, you have a postnasal drip that makes you cough, and you feel a tickle at the back of your throat sometimes. So that in itself is very similar, and it's full-blown allergy season right now, so you might even be confusing your symptoms with allergic symptoms with thinking, oh, this could be COVID-19 and I'm so scared, what am I going to do? Well, now you know, right? So you should be careful that if you are having considerable shortness of breath, say after falling sick for a couple of days, that you may consult with your doctor. In-person appointments are not encouraged if you have full-blown disease. That you still must contact your provider if you're in the US through a telehealth visit. I understand that in other countries that facility is being expanded as well. So make use of your telehealth consultations as much as you can. Well, so now what? I'm suffering. I recover as a healthy young person. You may recover, and when you do, then when can you go back to work? And along the same lines, when can a healthcare worker who's tested positive go back to work. So the answer to that, if you have recovered completely from the virus and you've done your isolation period, which is supposed to be around 14 days, you should be good to go by maintaining your work and your family schedule with them. However, that is not to say that you should be going into your offices. Remember, social distance is still the key. So keep that social distance, stay home. For healthcare workers, 2 weeks onwards, if they're not shedding the virus, they're good to go. Another couple of days later, their serum is considered gold. They're even encouraged to donate their blood for the immune globulins that might be used, filtered out for convalescent serum, as we're seeing in patients from Mount Sinai, that they've been asking for donations from this big hospital in New York City, and they'll filter out the convalescent serum and use it as a treatment modality. So there's good news as well for people who've recovered. Can you get it again once you've completely recovered? The simple answer to that is yes, you can. The longer answer is you need to be very cautious at all times, even after recovery. What is the likelihood for babies to contract this virus, and what is the prognosis? Well, unfortunately, there's been a documented case of coronavirus in an infant, so there is, in all likelihood, most likelihood in adults, but all likelihood that babies and kids can be infected. Hence the school closures in our state, in our country, and also worldwide. Is there any treatment approved for coronavirus? So prophylaxis, are we going to give something that'll make people feel better prior to them contracting the disease? Nothing's been approved. Everything else is a myth. So ignore anyone that comes to you and says, you take a malaria drug prior to it happening to you and you'll be safeguarded against its effect. No, not happening. Prevention. Mask wearing is a must. And what type of a mask am I supposed to wear? So those on the front lines, people like us, this is a huge issue. And over the course of weeks and days, it's culminated to a point where trying to understand better and guidelines are coming out on what we should be doing. As a general precautionary measure, mask wearing is a good idea if one is available to you, especially if you're living in an epidemic area such as New York City, for instance. But use your best judgment, consider the availability while going around on your trips to the grocery store. And where people are getting blasted with lots and lots of virus in the face, but they're a lot better than nothing when you're just walking around and you're exposed to all these community level amounts of virus. More importantly, anyone who is actually sick needs it to the point of being culturally unacceptable. In countries, in Asian countries, what we see is that people are polite in public, and when they cough and sneeze, they don't do it with their mouth or nose uncovered. They either cover themselves or and that's an opportunity for us to learn from. We are seeing in nations like Czech Republic this cultural tradition that have adopted it during the pandemic, and their transmission numbers, what we're noting right now, are extremely good, and that cannot be solely due to masks alone. So there's something else that they're doing culturally appropriate to their instance, which is making the transmission low. Here's the thing though, assuming you plan on reusing that mask, you need to treat it as though it's basically radioactive and contaminated. It's like a dirty piece of diaper, and it's covered in virus. That's what you have to think about, and you can only touch it with gloved hands. Launder it alone in ultra hot water. Especially, do not let anybody else touch it, and wash your hands thoroughly after touching it. Another critical point, a mask doesn't make you bulletproof. So there are different kinds of masks, like the KN95, which is used on the front lines in healthcare workers. There's the surgical mask, which is also used by healthcare workers, but anybody else who gets a hold of it is using it. Part of the reason why all these public health agencies did not encourage the widespread use of masks early on is because they didn't want to have people taking risks, like and not being socially distanced because they were wearing a mask. It's both and or, either or. Going out in public with a mask is kind of like saying, hey, I can drink and drive, I'm wearing a seatbelt. I mean, it's better than not, right? but it is better to stay home. So along with social distancing, every little step you take outside of the house, then you must be wearing a mask. This will be even more and more the case as we see now the epidemic ramping up, as the prevalence is increasing, and our chance of encountering an infected person in the grocery store or going out for errands is higher over the next ensuing weeks. So there's really good evidence and the efficacy of face masks, even if it's a cloth mask, right? So the humble little cloth mask is just as well. It's a small shift from the paradigm of using surgically approved masks. But what they have seen in some studies in Korea that I heard about in the Annals of Internal Medicine, it came up, and they gave known infected COVID-19 patients some cloth masks, and they set up a Petri dish full of viral growth media, and they saw that 30% reduction in the amount of virus that was detected in the Petri dish, as opposed to those people that coughed into the dish or were around the dish about, say, 8 inches away, with those wearing the mask versus no mask. So 6 feet away when you're standing in vicinity or in proximity of a person, or generally, and you're basically protecting somebody 30% of the times. So you can see how effective even just a simple cloth mask is, so don't discount that. Coming back to the treatment, we went into prevention. Takeaway here again is, what does hydroxychloroquine do? What is Plaquenil? Does it work? What about Tylenol? What about ibuprofen? So the takeaway here again is, the brakes are off, and all usual cautious standards of evidence we usually require to offer treatment to the public, it's all out there. A lot of this is very early observational data that wasn't ever rigorously studied. Sort of like a take it as you will approach. Some doctors noticed that a few young patients who took the ibuprofen did worse than those who took Tylenol, and then they told their colleagues, and so we were told to avoid ibuprofen. Was that a total red herring? Were those patients just sicker? We don't really know. It's clear that taking ibuprofen may not be as effective as taking Tylenol, which is acetaminophen, which actually reduces fever and pain. So it is good to work on the seriousness of the symptoms that a COVID patient encounters. The same is true for hydroxychloroquine. There was this French doctor again who was a maverick, and he was actually at one point formally disciplined for falsifying some data in the past, and he did a non-randomized trial of 20 patients, and he said it works. So if it works, it's got to work in virally infected cells like in a dish, but he never did any testing on mouse models. And what they're doing with humans is pure conjecture. It's being used, it's on the treatment guidelines for a bunch of hospitals and health agencies. We still do not know how it alters the immune system. The bottom line, there is no effective medical treatment for this novel coronavirus. The European Medicines Agency does not recommend avoiding ibuprofen either. That's the second takeaway. And the third is, the more we know, the more empowered we become. The more data we collect going down the line, the more empowered we become. This in a nutshell today is how I'm addressing what you should be looking into or thinking about when you're thinking about the disease itself, its treatment, and some prevention and guidelines. My next talk may focus on projections, and any other questions that you might have, please keep them coming my way, and thanks for watching.